In Singapore, there seems to be a growing sense of young people who are having depression and anxiety. Alongside with that, there is also a high rate of youth suicide rates. I'm Naresh. I'm the co-founder and executive director of Impart. At Impart, we give youths a fighting chance through giving them developmental opportunities such as education, mental health care, and community activities. As a lot of young people are also facing loneliness and social anxiety issues, we have created interest-based groups where young people can come in to express themselves through sports and to be able to interact with other young people. With the AVPN's Mental Health Fund, we were able to introduce therapy in a session where they are thinking about what they're doing in their routines, how they can think about their own self-esteem and their dreams and their hopes. This is something that we have been doing more in the community to build this kind of resilience among young people.
For mental health interventions and solutions, it's very important to be person-centered. It's not just about disorder, it's not about the symptoms, it's about their own personal experience. Through the process, are they able to regain their personhood, to understand their strength and build on their strength?
One of the very first youths that we have in our program came back to volunteer with us, and then now is one of our staff. He was working with this young boy that was actually recluse. He has not gone to school for more than a year. He found out that one of his likes was sepak takraw, and he was wondering whether we could start playing sepak takraw with them. At first, I was thinking, I don't think we are going to start another program because there's resources that we need to think about, but the staff was really persistent and he felt that this was an important idea for the recovery of this young boy. As I believe that the solution is with the community, I wanted to go along and to try to support this initiative. What was very powerful about this journey was that not only the young boy came into a place of recovery and growth, there were other young people who actually needed that support. Currently, it is one of the biggest interest groups in Impart itself, with about 40 over young people.
In the past, most of the mental health solutions are developed by professionals like researchers and practitioners. There's nothing wrong about that. But then what is lacking, in my opinion, is that youth need to be better engaged or more engaged in the entire process, especially from the outset. In a lot of studies, we show that actually people will drop out if they felt that they're not being understood, if the program is not directly relevant to them. And oftentimes we lack that feedback. If they don't come back, we thought that maybe they'd get better. But in fact, some people may be very disillusioned or they feel that they're not being understood.
Impart has an innovation program where young people are able to propose ideas with regards to mental health challenges that they have faced in the community. If the ideas are selected, we fund them and work through with them over a period of time. Some of the innovative ideas is crisis kits for young people when they are experiencing crises. Another one is a financial game board where young people can navigate financial decisions.
What I hope to see in this mental health space is more diverse options for people to choose from, because I believe that one size doesn't fit all. And by understanding each individual and by empowering each individual and then having options that is viable for them to choose, I think the mental health space can be so much more vibrant.